Hello, class. So today I'm going to talk about the pathological disease that I chose, which is invasive ductal carcinoma. A healthcare organization known as Cedars-Sinai mentions that some symptoms you might experience with invasive ductal carcinoma could be finding a breast lump or multiple breast lumps. You can experience nipple drainage. You can experience thickening of the breast skin. You can experience swelling in one breast over the other. You can experience redness or a rash on the breast. And you can also experience the nipple turning inward, etc. Cedars-Sinai also states that some risk factors might be age, a family history of breast cancer, or even obesity, etc. For some of the advanced treatments for invasive ductal carcinoma, the Mayo Clinic states that they offer a full range of treatment options, including surgery, chemotherapy, hormone therapy, radiation therapy, etc. The treatments are reducing the risk of heart damage of left-sided breast cancer. The Mayo Clinic also states that they avoid the need for a second operation, and treatments are being condensed down to less than 10 days. Advanced surgical techniques are also being utilized. According to breastcancer.org, follow-up care involves having a physical exam and medial history every 4 to 6 months for 5 years, and then every year after that. You will also schedule a mammogram of the remaining breast every year if you had a mastectomy, or arrange for mammogram of the affected breast 6 to 12 months with no mastectomy. It was stated by Johns Hopkins Medicine that invasive ductal carcinoma is diagnosed by digital mammography, ultrasound, MRI, staging workup, biopsy, or pathology. I chose to talk about invasive ductal carcinoma because at one point I had found a lump, and it kind of just brought it close to home about that I might have had the thought of, or the idea of having breast cancer for me. Luckily, I found my lump. I did a self-exam and I found it randomly, and I kind of went a couple months with it, and I was like a little nervous about it. And I finally said something. I had a surgery, and they took it and they did a biopsy on it, and it came back benign. They said that it was just a fibroadenoma, which is a fatty tumor. It was pretty big, but even after that, I didn't do much research on breast cancer. So I just thought when we were given this assignment, I felt like I needed to do a certain type of breast cancer because of what I had experienced. I think it's important for women, especially women. There's also men that can also have breast cancer, but it's more common in women. So with that being said, I think it's more important for women to really pay attention to how important it is to have knowledge on this topic, and to be self-aware of like having self-exams or giving yourself self-exams, and just having exams done in general, and just being aware of what might happen and why it could happen. So basically, I went ahead and chose invasive ductal carcinoma because it happens to be one of the most common types of breast cancer. About 70 to 80% of all breast cancers are invasive ductal carcinoma. A lot of this information is pretty basic, and it's very easy to find on the internet. But I feel like while it might be basic information, it's also very important information, and we should all know about it. I think the symptoms are something like the signs. Those are something that we should all be like looking for and just be aware of. Not something that should completely take over our day, but we should definitely, when we take a shower, just do a breast exam on ourselves and kind of just pay attention to what our body's telling us if we're reacting in a weird way. But while all this is very easy to find, I just thought that this was a very close to home type kind of topic for me. And I think that it would be very educational for everybody else, especially since this whole class is women. It's very important for all of us to know about it. And I just wanted to share my experience and also the information on this topic. So thank you for listening.